Hey, what's up, everybody? Welcome back to the channel. This is your favorite ringside physician, Dr. Jared Vasquez, and this is the Octagon Doctor channel, your #1 place on the internet to get post-fight MMA coverage from the unique point of a ringside physician. And today we're going to talk about Israel Adesanya again. His right breast mass was a hot topic Sunday and Monday. There were videos trending, then there were videos talking about the other videos. Trying to get a different point of view. Of course, I put out my own video, and that, it's almost at 70,000 views. There's tons of comments engaging. There's two teams. Team Adesanya didn't cheat. There's Team Paulo Costa. But really, we have to talk about something a little bit deeper than that because we have new information via Ariel Helwani and Israel Adesanya himself. But before we get to that, remember to punch the like button, kick the notification bell, and rear naked choke that share button because it gets my videos to more viewers and it gets the unique point of a ringside physician to all of your devices. So Israel Adesanya, of course, everybody saw it. Everybody has seen. It's an invasion of privacy. Everybody has been focusing on Israel Adesanya's right chest and the mass that he had that he clearly didn't have a year ago. And there was a lot of speculation from a lot of people. Of course, my video, it was completely neutral. I was merely explaining what gynecomastia is. It's a proliferation of glandular tissue, of breast tissue in a male, which is abnormal. And I left it at that. I put out a little bit of information. I didn't even film myself. I filmed it over a couple of pictures from the fight. And I just, made a simple video. It's one of my most simple videos. So there was no harm intended there. So if any Izzy fans were offended, it wasn't. I was just talking about that symptom. Other people were speculating in a stronger manner. I recommended the video if you guys want to know pharmacology and steroids and gynecomastia. More Plates, More Dates in YouTube has a great video that he goes in depth to that. I think he owns a testosterone clinic, and he has a wealth of knowledge in that, even though he's not a doctor. I think he employs doctors. He has a clinic. He said in his video, go check out his video. I'm going to put the link here in the description. I'm going to talk today more about how a clinician sees gynecomastia and how we go about to the process of trying to diagnose gynecomastia. So like I said before, gynecomastia, proliferation of breast tissue, glandular tissue in a male. There's two lines, right, of types of gynecomastia. We have physiologic gynecomastia and non-physiologic gynecomastia. So physiologic gynecomastia, when you are born, there's estrogen pass. If you're a man, you're in the belly of your mom. There's some estrogen passing transplacenta through the placenta, and most babies are born with some small amount of glandular tissue beneath their breast, and usually goes away by 4 or 5 months. So that's a physiologic, right? There's no pathological process in there. There's another cause that's prepubescent persistent gynecomastia. Hormones, right? Testosterone, estrogen. Again, More Plates, More Dates goes into it a little further in pharmacology, but testosterone and estrogen both are in both men and women at different degrees, different ratios, right? So there's not a male hormone or a female hormone. There's a male predominant hormone and a female predominant hormone, but we have both. Now, when the action of estrogen is unopposed in a late bloomer, in a preteen that's a late bloomer, you could have the expression of, and there's a large number of kids that have prepubescent persistent gynecomastia. So that little bit of breast tissue there, sometimes it fixes itself with when that ratio fixes and you develop. Sometimes it persists and you have to get cosmetic surgery and to fix that and feel good about yourself. And some people just don't care. But that's one of the causes that's physiologic as well, kind of a unbalance of hormone. But the non-physiologic, it's a myriad of things. It could be drugs, it could be a genetic disorder, it could be a tumor, and that's what really matters, because today Israel Adesanya disclosed that he was already getting a magnetic resonance imaging, an MRI of his pituitary gland, and he was getting an MRI of the breast tissue that he has on his right chest. So they are already deep into the diagnostic algorithm to see what's happening here. So in a very simple way, in a male that develops breast tissue, it's by hormonal action. So we have to think, where are hormones produced? There's a myriad of structures involved with hormone production, from the hypothalamus to the pituitary gland. You guys are seeing the pictures here on top of the video, to the adrenal glands, to the testicles, and in females, the ovaries. In any one of those places, something goes wrong, and you might have an imbalance that leads to gynecomastia, to growth of tissue where it shouldn't grow, glandular tissue where it shouldn't grow. So tumors in any one of those areas could cause the change. Chronic illness in any one of those areas can cause the change. Starting from the pituitary gland, sometimes trauma can lead to necrosis and vascular changes in the pituitary, and then you have your secretion of hormones is off, the ratio could be off, you develop gynecomastia. In the pituitary gland, hypothyroidism, 10 to 40% of people with hypothyroidism, males with hypothyroidism, could develop gynecomastia. So problems with the thyroid. Again, trauma in the testicular torsion can lead to poor testosterone production and gynecomastia. And this is one pet peeve of mine: the kidneys, the adrenal glands, your weight cutting, chronic kidney disease can lead to gynecomastia in some patients. Of course, there's a myriad of medications. I'm putting a list on top of the screen here that could cause gynecomastia. So you see how it's not that cut and dry. You see unilateral increased breast. Oh, no, it's steroid. We can't say that. We have new information via Ariel Helwani today in his interview that showed that Israel is getting an MRI of the pituitary gland, an MRI of the breast. They are already deep in the diagnostic algorithm, and they're gonna get answers of what's going on. What's a diagnostic algorithm? It's an order of things that we do as clinicians, as an internal medicine physician, as your family physician, as simple as that, to diagnose this condition. I'm going to put a picture here over the video, and it's just different steps. It all starts always with demographic data, a physical exam, blood work, and imaging studies. Depending on the different results that we get on each of these points of the diagnostic algorithm, is that we are going to get our diagnosis. Here, the bad diagnosis that we don't want to get, of course, is male breast cancer. Male breast cancer does happen. It's not that rare, guys, so we don't want, it's not usually common in young male like Israel Adesanya, but it's a cause of worry. So I'm hoping that MRI is normal and we don't have any malignant breast tissue involved in this case. Of course, testicular cancer would be a cause of gynecomastia as well. And in fact, there's up to 10% of testicular cancer cases, the first presenting feature is gynecomastia. So it's simple. When you visualize it, let's put a little map of a person with all the adrenal axis or all the little structures that are involved in hormone production. Any problem along that map of organs can cause this problem. So it's not as simple, guys. It's not as cut and dry of saying there's a unilateral problem in the breast is steroids. So it's a very complex issue. Here's hoping that all of Israel's workup is normal and we get to enjoy the last airbender, stylebender. Did I just out myself as a nerd? Maybe. You won't know. You won't know. I won't tell. All right, guys. Thank you for your attention. I definitely want to say to Izzy fans, this video didn't also say that he used steroids. It didn't say use steroids. People are so mad in the comments of my last video, and I thought nobody's gonna see that video. It's just pictures of me narrating. Oh, I was wrong. I was wrong. So if you like this video, and if this video kind of gave you a more clear idea of what Izzy is going through, please leave me a like, a share, a comment. If you're still angry, despite me just relaxed telling you have problems, get therapy. But stay in the channel, put your comments down there in the comment section. And until the next one, this is your favorite ringside doctor, Dr. Jared Vasquez.